Welcome, doctors. Today, we're going to dive into a topic that's been making waves in healthcare: the shift from fee-for-service to value-based care. This transition has fundamentally changed how hospitals approach patient care, quality measurement, and, of course, revenue generation. Under the old fee-for-service model, hospitals were reimbursed based on the volume of services provided. But in value-based care, it's all about patient outcomes, quality of care, and efficiency. Now, if you're wondering how this affects your bottom line, let's talk about one crucial element: tracking quality metrics in the hospital revenue cycle. This is no longer a nice-to-have, it's a must to ensure compliance, optimize performance, and maximize your hospital's financial health. So, why are quality metrics so important now? The revenue cycle is all the administrative and clinical functions that happen from the moment a patient registers to when they make their final payment. And under value-based care, these quality metrics play a huge role in determining how much you get reimbursed. If you meet the benchmarks set by Medicare, Medicaid, or private insurers, you could get incentive bonuses. But if you fall short, you could face penalties. Tracking quality metrics ensures that you're not just meeting these requirements, but also improving patient care, optimizing financial performance, and, most importantly, reducing readmissions and improving patient satisfaction. The bottom line is, the better your quality metrics, the better your reimbursement. So, what exactly are these key metrics? Well, there are a few critical ones you need to pay attention to. First up, patient satisfaction. If you haven't heard of the HCAHPS survey, it's something you definitely want to familiarize yourself with. This survey is a big deal when it comes to evaluating patient satisfaction, and it directly impacts your reimbursement. Hospitals that reduce readmission rates tend to see better outcomes and avoid penalties under the Hospital Readmission Reduction Program. We're talking about fewer patients returning within 30 days, which improves both your outcomes and your financials. Then, there's care coordination. Ensuring timely referrals, solid discharge planning. Follow-up care means patients get the right care at the right time, and you get to benefit from shared savings in value-based care models. Let's also talk about clinical outcomes. This one's all about improving patient health, whether that's reducing mortality rates, managing chronic conditions like diabetes from surgeries, and trust me, tracking these outcomes is crucial for value-based care. Don't forget preventive care. Metrics like immunization rates, cancer screenings, and chronic disease management are part of the preventive care umbrella. Hospitals that do well in these areas reduce the need for more expensive treatments later down the line. In value-based care, you're incentivized to provide high-quality care at the lowest possible cost without sacrificing patient outcomes. Monitoring metrics like average length of stay and resource utilization ensures you're operating efficiently. And let's not forget about patient safety. Tracking incidents like hospital-acquired infections, medication errors, and falls is essential. Hospitals that prioritize safety are in a much better position to avoid penalties and keep patients happy. Now, let's talk about how to actually track these metrics. It's not just about collecting data, it's about integrating it into your revenue cycle. You need to start with strong data collection systems, like electronic health records, EHRs, and patient management systems. These tools help capture real-time data, making sure you're tracking every aspect of the patient journey, from registration to final payment. Once you've got the data, the next step is performance monitoring. Dashboards or scorecards can help you track how well you're doing on key quality metrics. This is critical for identifying areas that need improvement. Another thing to keep in mind is collaboration. Tracking quality metrics isn't just the job of one department, it requires teamwork. Your billing staff, clinical teams, and finance departments need to be aligned. Billing staff, for example, need to understand which quality metrics impact reimbursement rates, while your clinicians must ensure care delivery aligns with those same metrics. Now, let's be real. Tracking quality metrics isn't without its challenges. First off, data integration can be tough. You're pulling from multiple sources like EHRs, patient surveys, and claims data. If those systems don't talk to each other, it's hard to get a full picture of your performance. Then, there's the complexity of metrics. With so many metrics to track, it can be overwhelming to figure out which ones matter most. Plus, each one has different reporting requirements, making it hard to stay on top of everything. And let's not forget resource constraints. Putting together a solid tracking system takes time, money, and people. It can feel like you're balancing this new priority while trying to keep everything else running smoothly. That's where technology comes in. Electronic health records, EHRs, are huge for tracking real-time patient data. With data analytics tools, you can aggregate information from various sources, giving you insights into how well you're performing on those key quality metrics. Revenue cycle management, RCM, software helps integrate quality metrics into your billing and coding process, ensuring accurate documentation and reporting for reimbursement purposes. Clinical Decision Support Systems, CDSS, can also help make sure you're providing the best care possible, directly impacting clinical outcomes. So, what did we learn today? Tracking quality metrics in the hospital revenue cycle is essential for improving patient outcomes, ensuring compliance, and boosting financial performance. By focusing on key metrics like patient satisfaction, readmission rates, and clinical outcomes, you can align your clinical practices with value-based care goals. And, by integrating these metrics into your revenue cycle, your hospital can thrive in this new environment. Thanks for tuning in, doctors.